I'm Kristen Jacobson, and I run omnichannel engagement and marketing at RevSpring.
Cool.
RevSpring is a patient engagement platform that provides end-to-end solutions for interacting with patients, primarily focused around payment use cases.
Okay.
So we really start at the point where a patient first becomes a customer. Mm-hmm. Price transparency, price shopping, estimation, appointment reminders, clinical reminders, all the way through billing and payments. Really kind of unifying that experience for the patient.
Yeah, that's half the challenge sometimes in healthcare too, is that whilst there's procedures or things that need to be done, it is a pretty unique industry. Sometimes you don't know how much it's going to be until it's done, and given that often they are quite material in value, that can cause a problem for many people.
And often you don't have a choice, right? So you have an expense that you need to have to take care of your health, and you have little choice around it, whether you can afford it or not, whether you're insured or uninsured. Out-of-pocket costs for patients are about 30% of the bill.
Okay.
And it's increasing.
Yeah.
So what we really do is try and understand the patient and understand their propensity to pay, like what can they afford, and their likelihood to pay, like are they going to pay their balance, so that we can really tailor our payment offers to individual patients so that we inspire them to pay in a way that's right for them.
Yeah, got you. And so you'll have quite a few stakeholders in mind as you're kind of designing out your thing. You got to make sure it's a good patient experience so the patients use it, but then also it needs to belong somewhere. So is the customer, I guess, for you the providers of healthcare?
Correct. Yeah. So we work with large health systems. We work with independent hospitals. We do a lot of work with urgent care, a lot of specialty groups, dermatology. Our platform is really broadly applicable to many types of healthcare organizations. And a lot of organizations are starting to move the payment experience up front, right? So having those conversations with patients earlier in the process, whether they pay or not prior to service, helping them understand what their bill will likely be, and providing them with options to pay even before they've had the service. So part of the reason we've built this end-to-end integrated platform is so we can infuse those payment conversations earlier. So the first time they're not presented with what their balance is not after they've had the service and they get that first bill.
Yeah, that makes sense. And despite the accent, I'm quite familiar with the funding models for healthcare in the US, and it's a little bit different to how we do things in Australia. I imagine there's quite a bit of interaction and engagement with the payers as well through the platform, because that's going to then determine out-of-pocket and things.
So we don't do a lot with payer communications. We do have some payers as customers.
Right.
But I think where we would touch the payer would be in the estimation process, understanding what the payer responsibility would be for that service based on their coverage, so that we could tailor the estimate to their coverage. So we do touch on that, as well as EOBs. This is not a bill, right? We provide those to patients as well. But we do less in the payer space, really more focused on providers.
Interesting. And so what brings you to HIMSS?
So we come to HIMSS every year. We have a booth. We have launched 3 new products. One is True QA, which is a quality assurance process that layers on our True Access product that really makes sure that the intake process is of high quality, that the data is at high quality. And then we announced 2 AI-based solutions. One is Seatmate. It is a CSR-focused application that uses a large language model to understand patient data, patient history, patient payment performance, patient payment options, to help call center agents have conversations with patients around their financial obligation in a more empathetic way. So it instead of call center agents having to mine, detail and history about patients, the AI does that work for them
Right.
and then serves up a script to them so that they can have an intelligent and personal conversation with patients about their balance. That's kind of the first phase of SeatMate. Later in the year, we'll turn that towards the patient themselves, so it'll be more of a self-service tool. We did this intentionally to have it be kind of a guide for CSRs first,
Yes.
to really perfect the answers and make sure before we provide as a solution
sense,
to
yeah.
patients, it's
Yeah.
it's high quality
Yeah.
content. And then the other product that we announced is Let's Talk. Also an agent, a voice agent, that is the starting point is we're helping just with routine questions into the contact center, into the provider organization, things that we can offload from the staff that a patient can interact with really easily. So questions about their appointment, what they need to bring, directions to the appointment, questions about refilling prescriptions, really anything that can offload those very simple questions from the staff members. And then we can also route calls that we can't answer to the right department or to automated solutions like our payment platform via voice solutions. So we're really kind of taking that AI agent in the call center and doing, starting to do some of that technology with patients as well, but in a really kind of an intentional and careful way to make sure that it's, a genuine experience and we're providing really sound help for patients.
That makes sense. As there's a lot of potential to utilize AI, large language models, to be able to crunch a lot of information, to be able to present to the CSR, to be able to then verbalize or communicate as a human, and provide that kind of bridge between the information. And then, I can see eventually as patients being the direct consumer of that information. Lastly, then thinking about, you're touching quite a few steps across the journey, and obviously done a lot of thinking around, how to make that a seamless experience as possible. We know that the entire continuum of healthcare is quite the journey in and of itself. What's the future look like for you? What's on the roadmap for the next 6, 12, 24? Do you continue to go down that route, or do you just dig further deep down this way?
Yeah, so we're continuing to focus on really integrating the end-to-end patient experience. So we have all the touch points, and we use intelligence at each of those touch points to really personalize those experiences. As we look forward, we'll look at kind of cross touchpoint interaction and using that intelligence across touchpoints. So, for example, learning from pre-care interactions how a patient might interact with their billing and payment applications. So today we use intelligence kind of within a particular use case, and we're starting to broaden that across the patient journey. And the other thing that we're doing is we're starting to use AI as well to understand where there are opportunities to improve engagement. So if I have a multi-touch, email, text, printed communications, voice communications campaign for a particular use case, where do I have an opportunity to improve that because I'm not getting the engagement that I should be out of those campaigns, and using AI to really serve up suggestions about how we can optimize performance based on what it's learned from those patient interactions.